These are my 3 audience members. Today I will be discussing the topic of memory loss. Memory loss can be caused by Alzheimer's disease, dementia, and even other possibilities. But today we are going to focus on dementia. Dementia is a condition where the memory is impaired. Many people get dementia and Alzheimer's disease confused with each other. However, dementia gets worse over time. There's several effects of dementia. It can impair one's memory, their speech ability, their ability to focus on something, especially conversations. It affects their judgment and how they perceive visual concepts. My grandma has dementia, and she gets very afraid and upset, especially if she's out and about without her husband and she forgets where she's at or forgets the people that she's with. The brain is a very undiscovered place in the body, so there's no set reason to why people develop dementia, and there's no set treatment for it as well. There are many causes stated by McGrill. He said that dementia could be caused by head injury, a stroke, a brain tumor, and even other unknown possibilities. Dementia can be caused by several factors, and it may be untreatable, but the most devastating fact is when it happens to someone you love. Research suggests that the hippocampus, which is part of your brain, is directly related to dementia. The hippocampus is related to memory loss, and if it is damaged, then it can cause memory loss, which can cause dementia. Another factor that plays a role in dementia is surgery. Whenever they put you into surgery and they give you anesthesia, it is said that the more surgeries and the more anesthesia you go under, it's harder and harder to wake back up each and every time, which may cause memory loss and loss of cognitive thinking skills. Another effect is medicine. Many people take medicine after surgery, which can cause that because they give you sometimes several medications to take. However, some people are middle-aged and above, and they have to take several medications to regulate blood pressure or sugar levels and other factors such as that. And those are not necessarily good to all take together because it is said that they can cause memory loss. It is said that some treatment may help dementia, but there is no set cure for it. But it is said that you can catch it early and it may slow the progress down. There are several preventions set by the Dementia Guide. They say that you need a healthy diet, maintain a healthy weight, exercise daily, do not drink a lot of alcohol, do not smoke, and keep a good blood pressure. Not only is my grandmother affected by dementia, but her family is as well. She gets very confused and anxious, especially if she's somewhere that she's not familiar with. She can be in her own house now because it's progressed so much and ask where she is, and she's lived there for 3 years. That's how great the dementia effects can be. My grandma can look at a picture for long-term memory. She can look at a picture of her parents and automatically say that that's my mom or that's my dad. However, she can look at pictures of her children and say, now which one was that again? Because dementia affects your short-term memory. And also, the hippocampus is part of your short-term memory loss. She can have a conversation with you. However, she cannot engage fully in the conversation because she forgets things after maybe 20 minutes or so, and that's usually dementia patients vary in time. She can ask you a question, and then 20 minutes later she could ask the same question without even thinking twice that she already asked you that question. Dementia is sometimes untreatable, and it can be caused by many factors that the science community has not even discovered yet. But it's such a terrible disease for not only the patient, but the family of the patient as well. It's hard to see a loved one going through something like that. Like I said before, the brain is such an undiscovered place. So science and the science community can say that there are treatments and there are medicines that may help slow the progress down of the dementia, but there is no known cure for it. They say that if it's caught early enough that they can put you on treatment and it may help. However, some people, dementia are not caught until later, so it's a little too late. Dementia can have traumatic and overwhelming effects on the patient. Having a loved one experience dementia and suffer through it is so horrifying and so serious. Take care of your body by preventing dementia, by exercising and eating healthy, because it's such a detrimental disease to go through. Thank you.